Okay, we're good to go.
All right. Well, I guess I'll start. My name's Jenna Wangren, and I'm a second-year student in the Master's Program of Social Work, and I am a HRSA grant recipient. Very excited to be here and excited to meet all the rest of you.
All right. Are you next, Marcus?
I'm Marcus Woodson. I'm in the MSW program. This is my third semester. My concentration is family practice, and happy to meet you guys.
All right, I'll pop next. My name is Jackie. I am in my fourth semester of the program. I started as advanced standing, so I don't have too much more to do, really just practicum after this. I'm doing the family concentration with the family specialist concentration in health and behavioral health. So whoever wants to take over next.
I'm Marlena Bagley. I am an advanced standing student right now, graduating next May, hopefully. And I'm also a HRSA recipient like Jenna, and my interests are mainly kind of the youth ages, adolescent years, younger kids.
Great.
All right, I'm Emily Barbie. Sorry you can't see my face due to technical issues. I am in my third semester of the program. I am a family practice student with an emphasis in health and behavioral health as well.
Cool. Well, thank you all for introducing yourselves. And like I said, I'm pleased to meet you. So I guess we'll start with the first question, which is a discussion of our own emotional intelligence. So my weak spot here is definitely self-management. So that's the adaptive, optimistic, and management of response to conflict. So I try to avoid conflict at all costs, and that's kind of something that I'm trying to work on. And to improve that, I'm challenging myself this semester by I am doing my elective at the Integrative Behavioral Health Clinic. So that'll be a challenge to build my self-management as I adapt to learning through criticism. That'll be huge for me, so that's exciting. And then I think my strength is social awareness, maybe. So that's the empathy, sensitivity to verbal and nonverbal cues, and then a keen sense of others. So I think that I've always been drawn to empathizing with people, which is what brought me to the field in the first place. And then this strength will hopefully help me build a therapeutic alliance with clients who I only have 15 minutes with, if I do integrative behavioral health. Hopefully that'll serve me well.
I still can't wrap my mind around that whole 15-minute thing. That's still completely flabbergasts me. But Jenna, I kind of agree with you on some issues that I have as well when I look at my emotional intelligence. Conflict is definitely something that I try to avoid. I know it's inevitable, and as a manager now, it's definitely it happens. It happens a lot, and it still bothers me to this day. So I'm with you on that one. Definitely, but like you said, got into this field because of empathy and empathetic, and I have some self-confidence, so that helps me as well to work in this field. I feel like you have to keep your head held high, otherwise you might fall. So,
well, I think one of the things that I need to work on is self-awareness. Just kind of managing my emotions, because I'm so passionate about working in substance abuse. And when people don't make it, don't stay clean, or don't, I kind of get in my emotions about that. I expect them to get this, and when it don't happen, it's just I got to kind of balance that and know that we can't fix everybody at
right.
social media.
Yeah.
And one of the strengths are, I guess, self-management, being optimistic that, that we are making a difference as social workers, even when, clients, sometimes don't live up to some of my unrealistic expectations.
But just aiming high.
Yes.
Since I'm kind of similar with Marcus with the self-awareness, just because I'm sure we all do it. We kind of take our clients' stories home with us after we meet with them or get to know them. And I know when I did my practicum at the Juvenile Justice Center, it was really hard for me. Like, I get so attached to the kids and wanting to help them, and like, oh, they want to like apply for this job and they want to look into this, and I'd be like doing it at night, and I'd be like, no, I need to go to bed. Like, worry about this when you're there, and like separating that, and like, so that's definitely my downfall. It's hard for me to separate that, like where you draw the line with kind of how you interact with your clients.
Right.
Yeah, I would definitely agree with Jenna and Maggie that I too struggle with conflict, as well as Marlena and Marcus, because I take my work home with me every single day, and self-care is so important when you're a social worker.
Yes.
I know we stress self-care so much, and it's so important. And so I'm just now realizing, because this is my first semester in my specialization practicum, and so I also have a full-time job. So things kind of get crazy, and you really have to work on taking care of yourself. But in terms of emotional intelligence, I feel like we as social workers, we have to have some sense of emotional intelligence, because you know, we have to be able to recognize potential issues that may arise when working with certain clients. And, you know, for me, I'm really good at picking up on the nonverbal cues. For example, today, actually, in my practicum site, I work at Comprehensive Mental Health. And so I had a session with a couple who were seeking couples counseling because they're trying to decide whether they want to go through a divorce or not. And so I was asking the husband a question, actually, and his wife just was rolling her eyes and crossing her arms in response to the question that I had asked him. So obviously, you know, it was pretty easy for me to pick up on the fact that she did not agree with what he was saying. So, you know, I further probed that and asked her, you know, why she was feeling that way and whatnot. And so it's kind of like those type of things that are really important when working with clients, is just being able to pick up on not only the verbal cues, but nonverbal cues as well.
Absolutely.
Yep.
Absolutely. Well, thank you guys all for your feedback on that. And I guess unless anyone has anything else to add, do you want to move on to the next question?
Yeah.
Awesome.
Yeah.
So how would you handle it if a consumer presents with an issue that is beyond your current competence, but the consumer has no other treatment options and refuses to accept a referral? So I'll let someone else start by taking the floor for this question.
I feel like for that, I mean, it's almost common knowledge to us, like if the client's not wanting to accept any other referrals, as social workers, we're mediators, and our job is to find that solution for them. So, I mean, if it gets to a point where we don't know the answers, I mean, just go ask and kind of find out the resources, find someone who maybe is more in depth in that, and they don't have to be the referral, but you can use them as a source.
Right. And that was something that I put, since we are kind of new social workers, was to go find supervision. I don't know how many of us want to go the clinical route, but somebody at our job will be supervising us. So going a step above.
Definitely.
And that's that's definitely what I would do also, because being new, and I'm finna start a new job next week as the community support specialist. And I was telling the executive director, you know, be prepared for a lot of questions and, you know, help, because, you know, it's a lot of things that I don't know. You know, you learn a lot, you know, from your practicum and things like that. But once I'm in the field, you know, that's how I'm going to learn how to resolve things. Is I have to first reach out for the help, and how would you handle this? And then, you know, if this situation shows itself again, I'll be better equipped to deal with it. So, yeah.
Yeah, I definitely agree that, you know, talking to your supervisor is something that's extremely important, just because, you know, having another person's professional opinion on how they would interact with a consumer is extremely important. But also, just to add to that, I definitely think that, I know in my personal experience, sometimes it's difficult to get in with a supervisor or make an appointment with them immediately. And in certain situations, if you're seeing this client regularly, you might not have time to see them. And so if you do run into that obstacle, you can always rely on evidence-based practice. You know, just do your own research. We always stress EVP in all of our classes. And so I definitely think that even just doing your own research, and then if maybe you catch your supervisor in the hallway, like you've already done your research, you just ask a quick question, get a little bit of, how they feel on it, and then, move forward with working with their issue.
Yes, super important, Emily. Thanks for bringing that up. Also, something else that I had down was transparency with the client about this. So making sure they know that this is not necessarily your wheelhouse and trying to push one more time for that referral. But then, really trying to be transparent. Like, I will do my research and try my best, but this is not something I'm familiar with. But, if you're their only service option, then like you said, Emily, doing that research and figuring it out so you can serve that person.
And you know what?
Yeah, definitely.
Sorry, Emily.
Oh, no, you're fine.
But I'm going to add to that as well. I feel like if you cannot get a hold of a supervisor, it's going to take some time or whatever the situation is. As you build that relationship, you also build trust. So hopefully with building trust and building a relationship, maybe they will take your input as a referral as it goes on. So, with that, just as it goes down to the key, of social work, you build relationships and you build trust so that, you can give people the help that they need.
Yeah, because I may run into that exact situation when I start a new job next week. So, it's good that we're, kind of having this conversation because I need to hear what you ladies have to say. And because I'm kind of nervous because it's my first, job, working in the social work realm. So, and these things, this is liable to pop up, my first week. So, thank you.
Yeah, well, congrats on that job. That's exciting.
Oh yeah, I'm very excited. But kind of nervous at the same time, because I don't want to. I guess I put high expectations up on myself because I don't want to, go in there and just be useless. But I am beginning, so.
Yeah, be kind to yourself in the learning weeks and months.
Right. Thank you. I definitely will.
Self-care.
Yes. Yes.
Don't give up bags, please.
So anybody else have anything to add on that question, or should we move on?
I think we're good.
Move on.
Awesome. So the discussion of the overall concept and models of integrated behavioral health as it relates to youth. So something that I kind of noticed in the SERVE model was the S, which was seeing the future and envisioning a picture of the perfect future. There are endless possibilities for young people. And so that's kind of an exciting aspect of working with young people, especially with the SERVE model. So that was something that I picked up on and look forward to applying in the future.
Just to add kind of to that, I actually was looking at a completely different model. So it was interesting to kind of hear your take on that specific model. But I was looking at the Wagner's chronic care model, actually. And it kind of brought to mind a specific example of, she actually had this in the notes. It was type 1 juvenile diabetes. So that's specific to youth. So in regards to just integrated care, diabetics typically see an endocrinologist, which is like a blood doctor, to go over, how their A1C levels are doing, basically if they're keeping their blood sugar where it needs to be. And, maybe they also see a general care physician because their immune system is lower, so they're more likely to get sick often. Maybe even a psychiatrist or social worker, for depression as a result of the juvenile diabetes. I know there's a high rate of depressed diabetic youth because of just the chronic illness. So I know that working with a collaborative team is kind of what the chronic care model focuses on. And so having all of those doctors and professionals helping with all of the youth issues, it would definitely benefit them to have integrated healthcare, because if all of the doctors are talking, then they're all up to speed as to what's going on with this specific individual.
Definitely.
And kind of going on off Emily said with the chronic care model, because I remember reading that one, really liking it, just because like the main concept is just like, instead of like focusing on like the later issues, like focus on like prevent them from happening, basically. So like get them the help they need before they even need the help. And I just love that concept. Just going off of
Yeah,
Emily.
definitely.
Sorry, I'm just writing.
Yeah, no,
Very good.
that's a hard job. Well, Marcus, did you have anything to add to this one?
No, because I didn't really get to read the models
Yeah.
and get to read it as a whole. But I looking at it now.
Well, I feel like maybe something that you might be able to add on to is the idea of resiliency, and resilience just kind of as an overarching theme of all the models is like youth kind of have an ability to build on their resilience young. And so I don't know, I feel like that's pretty interesting. And then leadership, being able to kind of, use our leadership to instill in youth. Do you think that that might be useful to them in their future to kind of model that leadership for them?
Yeah, I think so, because I feel strongly that, and I was looking at that, the leadership. I think I agree with that. The leadership would be definitely a model that for us I can apply and learn more about in my profession. But like I say, I didn't get to read and go over the model, so I'm still kind of, looking it over myself. So
Yeah.
I'm just giving you guys feedback.
And there were quite a few models and a lot of reading this week, and especially
Yes, it was.
there was such time constraints this time around.
Yes.
So hopefully in the future we'll have, an easier,
a little more time.
Yes. So
I mean, there is no way we could have, with the time that we all have,
No.
there is no way we had to do this today.
you guys, there were
Even though it was due Thursday, when I looked at all the emails, I'm like, well, it's no way,
it had to be.
Yeah, I know a girl among the other groups, and she said that the only time that they have is tomorrow night at 11 p.m.
Yes, and there are like 150 pages of reading or something.
Yeah.
Like that. Just really.
I know. I was like skimming through like the questions, like, all right, find a model that you like. Like.
I know.
Well, you do what you got to do. You get it read for the quizzes.
Exactly.
So I can level with you, Marcus, on not being able to get through all that, and there were so many models. So I just, I wanted to check before I overpass.
One of the slides was like 85.
Yeah.
Like 85, and I was like, wow.
I know. It's overwhelming, but at least
Yes.
we'll have it, and we can save it and go back and reference it later. So that's what's really important, I think. So then I guess we'll head on to the next question because it's getting late. So I'm really sorry, y'all. I'm reading my own notes in addition to these. So, okay, discuss a minimum of 3 questions and answers from group members regarding material presented in week 1 and 2. So does anyone have any questions that they want to pose to the group?
Oh, I do. Okay, so when I was reading chapter 7 in Curtis's book, it's a part of it talks about the cross-cultural issues in integrated healthcare. So my question is, how would you propose that we as social workers could become more culturally competent to those populations discussed in chapter 7, since we're required to provide culturally sensitive services to everybody? What kind of things can we do to broaden our spectrum and our mindset and our knowledge for working with those specific populations? Because I wrote down maybe trainings, but there's limited free trainings out there, so I didn't know. I wanted some feedback on that.
For me, I I watched a video on cultural competency 2 days ago, and for me, it's just learning about the population that you're dealing with. For us, we have the second largest group in this country is Hispanics. So for me, I just learn more about the culture because I know that's who I would be dealing with, for the most part, that's, I would need cultural competency with that group of people. So learning more about the culture.
Okay, so like specific to the population that you work with at your job, you just did research on like the Hispanic population and kind of what their culture looks like. Oh, okay.
Right.
Okay.
And it's
wonderful.
It's easy to, when you're working in a job with a high number of certain people from like certain different cultural backgrounds, it would be kind of easy to sit down with them and kind of task them with teaching you about their culture. But we're really not supposed to put that on them. Like they have to teach us, because really we're there to help them. They're not there to help us. So I think what Marcus said is really important about, going about it on our own time and figuring out what populations we'll be working with and going, deep into the research, and then also like seeking out, experiences. Maybe that's going to some kind of food or music festival or something. I don't know.
Yeah, I agree. I agree with that because they, St. Louis has the, there's a big cultural fest in Tower Grove that just happened over the weekends where all the different nationalities come together. And it's different food, it's different music, different dress. So that can kind of give you a glimpse into what's going on. And I feel like sometimes Google could be a good outlet. Just the culture norms. It's not going to go for everyone. And it's not going to, it's not going to work. But you could at least get a basis and then maybe get a feel from that. And one other thing, we have 8 minutes left that we can record.
Okay.
So I just popped up on my screen.
I like it.
I see it on mine too.
Marlene, did you have something to add to that?
8:26.
I was going to say, I feel like a lot of it, as social workers, like we're not supposed to make judgments. We're, stay open-minded. I just kind of basically what all you just said, when an opportunity comes that you can learn about someone, take it. And if you need to learn about someone, then do it, kind of thing. Just figure it out.
Yeah,
because we're gonna be forever, learning in this curriculum. We're gonna, this is an ongoing process. Even when we graduate, we're still gonna be learning a lot of things just from our organization, the way it's ran, and the different people that we're dealing with, and new methods on how to deal with them. So I just feel we're gonna learn more on our own time if that's what, we want to do. Like, for instance, if I know that I'm working with a large Hispanic population, which could be very, a reality for me, that's what I do. I just take, time on my own, to learn about the population, more.
And we are new at this, so, experience will bring more cultural competency, I think, as we spend more time in the field. That'll come naturally. Anyone else have another question? Because I got one I can lay on you.
Yeah.
So
go for it.
We kind of already touched on this earlier, but how we're going to be typically seeing clients for like teeny tiny 15-minute assessments and things like that. There's a lot to cover in that amount of time. And the 5 A's model seems really concise and covering, like, what is it? It's like, it's assess, advise, agree, assist, arrange. But I'm wondering, how are we supposed to create like an empathetic, therapeutic relationship within that time as we're doing all of those things? I feel like the relationship might get kind of lost in the shuffle. What do you guys think about that?
Well, I feel like I've kind of, like, we've discussed this in class or my BSW classes a lot, where it's just kind of like, sometimes you just only have so much time, and you kind of have to like learn that, maybe the first few times you do it, you may not gather all the information, but with experience, with everything that we learn, we're going to eventually pick up like, oh, these are really important aspects to touch on, and like maybe I should speed up this. But I mean, going off what you said, I mean, 15 minutes meeting someone, like it feels impossible to be able to make an assessment off them with that brief amount of time.
And to get them
That's good. So, and I got a question. In that brief amount of time, what evidence-based practice would you prefer, each of you prefer in that little bit amount of time? Me, I would choose MI. That's one of my favorites, motivational interviewing. So I just like to hear, you know, what would you guys do if you had just that small amount of time and trying to make a big impact in that small amount of time? What?
Yeah, I can jump in on this one. So, you know, we kind of talked about, you know, how do you establish those relationships with your client, and, you know, how are you going to be able to gather the information in the short duration of time? Well, for me, I would definitely use CBT. Cognitive behavioral therapy is extremely effective over a long duration of time. And so even if you're having 15-minute sessions, say you see somebody for like 2 years, well, in the beginning, it's more important to make a personal human connection with someone than it is to be clinical with them immediately, because you have to establish a baseline of a relationship with them prior to, you can't just ask somebody like, you know, what is your deepest, darkest secret? Like, what brought you into treatment? You know, you can't ask them their personal problems on the very first day. It's more about, you know, creating that bond with the person, you know, meeting the client where they're at. And so eventually over time that develops trust, and then people, you know, they'll feel more comfortable coming to you and talking to you about really deep-rooted issues. And so I feel like CBT is something that is really effective in using that. But yeah, I also like motivational interviewing, and it's definitely helpful in the short 15-minute increments, just because, I mean, it's really easy to speed through MI. CBT is kind of more of, I mean, you really have to put in the work and the time just to get through it, but it is pretty effective. So that's kind of the route that I usually go with CBT.
Okay.
And I think motivational interviewing is something that can be sort of infused into a lot of other evidence-based models too, you know, because it's really just kind of a way of communicating, and it's a way of, you know, leading clients to their own conclusions. And so then they have the buy-in because they're motivated, you know, it's based on their motivations and things like that. So I think those are awesome answers. Does that help, Marcus?
Yes, it definitely does. I mean, because I was working in my practicum, and, you know, the evidence-based practice that they use there, other than 12 steps, was CBT, you know, and motivational interviewing. So I was just curious, you know, what you ladies thought.
Anybody else have any closing thoughts as our time ticks down here?
I don't.
Okay. Well, you guys, this has been a really great discussion, and I look forward to working with you all in the future.
Yes.
If there's no other closing thoughts, then I guess we can let each other go for the evening, get some rest.
I will agree to that.
All right.
Bye.
All right. Bye, guys.
All right.
Push the wrong button.
I know, I'm trying to figure out how to get out of this too.
Every time I do this happens.
What do we do? Just put